Welcome to Ask Dr. Mingle, the Q&A series from Mingle Health answering your questions about quality programs and the transition to value-based care. I'm Kyle Breckel. I'm a digital marketing specialist here at Mingle Health, and I'll be hosting this episode along with Dr. Dan Mingle, founder and CEO of Mingle Health. Hi, Dr. Mingle.
Good morning, Kyle, and good day to all of you tuning in. It's great to see you again. I'm Dr. Dan Mingle, and I'm here to answer your question to the best of my ability.
A quick reminder before we begin, if you have a question for Dr. Mingle, you can send it to us via email at hello@minglehealth.com. You can leave it in a YouTube comment or in a comment on LinkedIn. Are you ready, Dr. Mingle?
Bring it on, Kyle.
Okay. Our first question for you today comes from Janice, and Janice asks, in the first year of our ACO, APP scoring is pay for reporting. As long as we meet case minimums and data completeness criteria, we get full credit for quality, no matter what our performance score is. Does that mean that our MIPS-eligible providers get full credit for quality in calculating their MIPS adjustments?
Great question, Janice. And the answer is no. You're referring to the quality standard for MSSP, that's Medicare Shared Savings Program, ACOs, in the first year of their first contract period. They need, starting with a 2025 performance year, to submit the APP Plus measure set, not the APP measure set. And if their submissions meet data completeness requirements, they meet the quality standard for that performance year. After the first year, they have to meet the full quality standard. It's pay for performance, not pay for reporting. Now, the APP Plus submission is also applicable to the MIPS-eligible providers in the tax ID number practices, that's the TIN practices, participating in the ACO. Those MIPS-eligible providers in each practice are assigned the APP Plus score. It's important to note that the APP pay for performance credit is applicable only to the ACO quality standard, on which collection of the ACO's share of shared savings or shared losses depends. For MIPS providers, it is pay for performance, not pay for reporting. Even though the ACO is pay for reporting, the MIPS is still pay for performance. The performance score matters. For MIPS eligible providers in your ACO participating tax ID number practices, they are also subject to the rules governing multiple submissions. To improve their MIPS adjustments, they are eligible to make multiple submissions. They will benefit from the highest submitted score. So if the APP Plus score isn't enough to earn them a positive adjustment, perhaps a different submission will. They can make individual submissions and or participate in one or more group submissions. They can make ECQM, MIPS-CQM, QCDR, and or Part B claim submissions, or any combination of those. And even multiple submissions of the same type if they come from different sources. So I won't even try to calculate how many they can make, but they will always get the benefit of the best score submitted. So remember that the quality score generated by your APP Plus submission can count score-wise, not just pay for reporting, but pay for performance for your MIPS providers. Take it seriously. Make sure your MIPS providers are covered.
Great question, Janice. And Janice has a follow-up question for you, Dr. Mingle. She asks, I understand now that the APP Plus quality score will apply to the MIPS-eligible providers in our ACO participating TIN practices. If we are an advanced APM ACO, then MIPS scoring does not apply?
Another great question, Janice. The answer is no. Again, you're likely to need a MIPS quality score for some of your providers, even if you're an advanced APM. The Medicare Shared Savings Program, the MSSP, like any other APM, can be a MIPS APM or an advanced APM. In the case of the MIPS APM, none of the participating providers will be a qualified participant. That is a QP. Everyone will be subject to a MIPS score and a MIPS adjustment. Participants in that MIPS APM are eligible to collect shared savings, and the MIPS adjustments will pile on top of that, adding to the gain or diminishing the gain, whether it's a positive adjustment or a negative adjustment. Now, if you're an advanced APM, none of your qualified participants, that is QPs, will be subject to MIPS. But there are likely to be providers in your ACO participating practices who are subject to MIPS. It hinges on the QP designation. there's a threshold measurement done by Medicare that each provider has to meet to be considered a qualified participant or QP. It's the percentage of the total unique Medicare patients you see that are ultimately attributed to the ACO that determines QP status. It's calculated and tracked by both count of patients and dollars of allowable charges. So it's percentage of your patients by count that you've seen that become attributed, or or a percentage of the dollars allowable charges billed, all your patients versus your attributed patients, that determines QP status. Hit either of the year-specific thresholds and you are a QP. Miss them and you're not. There is a partial QP designation that has a lower threshold, and partial QPs can decide to be included in MIPS or not. QPs don't have a choice. They're out of MIPS. Not those who don't hit either threshold are in MIPS. So those who have not hit one of the thresholds do need a MIPS score, or they'll get a negative adjustment in each performance year. In any individual practice in an advanced APM, MSSP, or otherwise, in any particular year, all providers could be a QP. Some providers may be QPs, or no providers may be QPs. No matter what your ACO contract looks like, MIPS APM or Advanced APM, you always have to be alert for the MIPS eligible, or maybe we should express it as a MIPS liable provider. Your APP Plus submission might qualify you to collect all of your shared savings, but result in a negative MIPS adjustment for your MIPS liable providers. Now, you're more likely to be a QP if you're a primary care provider. They're going to have more patients attributed to them than most of your specialists. Your specialists, you're more likely to be a non-QP or a partial QP. A single specialty group that's in primary care, again, everyone might be QPs, and a multi-special group with a lot of specialists may have a mix. Your single specialty group may come out without anyone being a QP. So be aware of your MIPS liability when you're making your quality report for the ACO.
Great question, Janice. And our final question for you today, Dr. Mingle, is from Robert. And Robert asks, in our basic MSSP ACO, just one-sided risk, our participating providers can collect both shared savings and positive MIPS adjustment. Does that mean that they can be better off than qualified participants in MSSP ACOs that are two-sided risk, subject to shared savings and shared losses, and not able to collect a positive MIPS adjustment?
Great question, Robert. There are similarly two potential gains for your qualified participants, just like the MIPS counterparts. They're subject either to shared savings and shared losses, and they're not subject to a MIPS adjustment, positive or negative, but they do get a bonus for participating in an advanced APM. That bonus is always a gain, it's never a loss, and it's not dependent on anything except being a qualified participant in an advanced APM. It's not subject to the quality scores or promoting interoperability submission or anything else. From the first year of the QPP through the 2024 payment year, QP's got a 5% positive adjustment on Medicare Part B payments paid as a lump sum. For the 2025 payment year, QPs get a 3.5% positive adjustment on Medicare Part B payments paid as a lump sum. For the 2026 payment year, QPs get a 1.88% positive adjustment on Medicare Part B payments paid as a lump sum. Plus, they get a better conversion factor on the physician fee schedule than do their peers who are not QPs. In years to come, we don't expect any lump sum positive payment adjustment, but we do expect that preferential physician fee schedule to apply to advanced APM participants, that is, qualified participants, from now on. Note that the adjustments are static, not based on scoring, independent on shared savings and losses, and always positive. Everyone gets the same reward if they're a QP. unlike MIPS scoring that has never been higher than about 2% and can just as easily be negative in any year as positive. So there's those two potential rewards for your advanced APM participants, both the collection of shared savings and that incentive that goes on, not quite as much as it was to start with at 5%, but there's still a positive adjustment for being a qualified participant. Thanks. Great question, Robert.
Yeah, great question, Robert. And thank you, Janice, as well, for the excellent questions. And thank you, Dr. Mingle, for sharing your insight with us today.
Thank you, Kyle, and thanks to everyone for all the great questions. I want to be helpful, and I want this to be useful to you. Don't hesitate to correct or supplement my answers. Share your experience, ask your questions. We can be smarter together.